another serious problem in the health sector. So ito naging problem na to during the pandemic. Actually, even before the pandemic, nurses have been leaving the country in their quest for better working conditions. And up until now, malaking problema pa rin itong mga health workers natin na underpaid, overworked, and actually, lagi silang mga nasa streets protesting for their delayed and unclaimed benefits. What are your suggestions, of course, to solve the problem on delayed benefits and unreleased benefits allowances of our healthcare workers who are in the front line of our pandemic response?
Bonds, one of the things that I really intend to do is to boost the morale and welfare, most especially of our frontliners, especially those who are in the medical field. I have done that in the Philippine National Police, and I hope that I would be able to help the employees, most especially the nurses and the doctors who are, as you said, have not yet received bonuses or etc. or whatever the government has given, has given and is still giving. I hope to discuss this with the Execom because it has also catched my attention, considering that there are people who are complaining about this. I still have to ask, of course, and at the same time, uh, through the executive committee meeting, we will be able to come up with solutions on how we would be able to help out in the, of course, in the boosting of morale of our people, most especially in the field.
Okay, right. It's interesting and actually it's really glad to know na parang ito talaga yung parang nakikita nyo din na problem na kailangan ding bigyang pansin ng Department of Health, which is the boosting ng morale nitong ating mga healthcare workers because after all, sila
Yeah.
kasi yung nasa frontline talaga ng pandemic
Totoo. Alam mo,
response.
Bonds, if I may add, alam mo, when the PNP went to the streets to at least prevent the spread of COVID through the conduct of checkpoints, choke points, and educational information to our kababayans. We in the headquarters were also busy coming up with medicines and vitamins for our people, and we distributed this to all the checkpoints, most especially here in southern Luzon and northern Luzon and NCR, of course. Wala lang masyado sa northern Luzon kasi ang ang focus natin nun was NCR and those areas going most especially to the south. Kasi nga, yan yung daanan yan ng ating mga kababayan papuntang south. So, this is what we work for. And we're hoping that while we are already being able to prevent the spread of COVID, we would be able to learn more how to come up with activities that will, of course, take care of the welfare of our people, most especially with regard to their morale.